At this conference, I'm presenting the results of a phase 2 study of glofitamab in combination with Pola-R-CHP in patients with newly diagnosed diffuse large B-cell lymphoma. We know from the results of the POLARIX trial that Pola-R-CHP improves progression-free survival as compared to R-CHOP in patients with newly diagnosed DLBCL. However, patients with relapsed or refractory disease can still be difficult to manage. So we hypothesized that the addition of glofitamab, which is a CD3/CD20 bispecific antibody that's already approved in the relapse setting, to Pola-R-CHP would improve outcomes for these patients. So in this study, all patients were treated with 2 cycles of Pola-R-CHP, and then at that time they had an interim PET scan, and we collected blood for testing of minimal residual disease. The glofitamab was then added in cycle 3 using step-up dosing and continued in combination with Pola-R-CHP through cycle 6. Patients then received 2 cycles of glofitamab at the end of therapy. We saw that this regimen was well tolerated with side effects that you would expect for Pola-R-CHP. And then notably, we saw that there were very low rates of cytokine release syndrome, or CRS, which is a known toxicity of glofitamab. Of the 40 patients in the study, we saw that only 4 patients had CRS, and it was grade 1, meaning that the patients had a fever alone, and 2 of the patients, the fever resolved without any intervention. So that was lower than we have seen in prior studies of bispecific monotherapy. So it may be that the 2 cycles of chemotherapy reduced that CRS risk. We also saw that the regimen was very active. The overall response rate was 95%, and the complete response rate was 90%, and even 2 of the patients with a partial response at the end of therapy went on to convert to a CR without further therapy. There was 1 patient with progression of disease, and that was at the beginning of cycle 3, even before the patient had glofitamab. So overall, we're very excited about this regimen. There is a phase 3 trial that's ongoing comparing glofitamab-Pola-R-CHP to Pola-R-CHP alone, and so I'm really eager to see the results of that study and to see if this type of regimen will change our practice.